So I would now like to introduce Dr. Jeanne Conry. There we go. Who is a fellow of the American College of OBGYN. She spent many years in OBGYN practice and leadership at Kaiser Permanente, Northern California. She was trained, got her MD at UC Davis and did her OBGYN residency there and got her PhD at University of Colorado in Boulder. Dr. Conry has been past chair of ACOG California District 9, which is the one we're in. She is past president of the American College of Obstetricians and Gynecologists and past president of the International Federation of Gynecology and Obstetrics, or FIGO. Currently, she is president of the Environmental Health Leadership Foundation, which is an organization that serves as a consultant to global organizations for implementing clinical guidance about environment, toxics, as well as climate change on health, furthering education, advocacy, and research in these areas. She has been honored by the U.S. House of Representatives for her accomplishments and also received the Visionary Leadership Award from the University of California and also an award from the Environmental Protection Agency. So today she is going to talk to us about preconception to infancy, reproductive health, and the environment. Jeanne, welcome.
Thank you so much. And I really appreciate being here because of everything UC San Francisco does and really started much of the work I'm going to talk about. Just for conflicts of interest, I sit on the board of the Forum Institute, which is a nonprofit organization, but they are dedicated to maternal infant health and environmental concerns. So I'm very proud of the work that we're doing there. I have done lectures for Hologic on the Women's Preventive Services Initiative. They take the initiative and they've just been able to have me go to family practice meetings and a couple of others just to present what WPSI is about. But I will mention the work of WPSI while I'm here. My objectives are pretty straightforward. I want you to understand what preconception to infancy is all about, understand the role of environmental toxicants on reproductive health, and then ask you to be advocates for certification of product safety when it comes to reducing adverse maternal health outcomes. And a little bit about mass spectrometry. You've got more experts in mass spectrometry than I am, but how to measure bioburden and understand why we need to talk about individual risks and counseling for individuals. Preconception to infancy is an initiative, and it really takes three important elements. And I would say one of the elements we're very well versed in, how do we improve the health and well-being of women across their lifespan? The second, we're also very well versed in safe and respectful maternity care. We know what we need to do, and there's a lot of literature. We realize what we've got to do, but I'd say we're often novices when it comes to the environment. So when it comes to care across the lifespan, WPSI really is the gold standard for the United States and the world. What WPSI has done is set an example of how we need to bring together family physicians, internal medicine, OBGYN, nurse practitioners, midwives, and address women's health. And again, I say across the lifespan because we've got a women's chart and clinical summary tables. I no longer oversee WPSI, but it's been in place since about 2015. And the goal really is to take what we know about women's preventive health and be able to describe what we need to do at every well woman visit. It's important because the Affordable Care Act said we will cover women's preventive services. So we need to speak with one unified voice on what we've got to do for women's health care. You can take so many webinars, you can take resources from it. It's an incredible amount of work that's come through Health and Human Services. And I'm very proud of the work that WPSI continues to do. What do we need to do when I talk about preconception infancy? We just have to amplify this message. It's out there. We know what we should do. We've got all the resources. So amplifying how important well woman healthcare is critical for all of us. There's also safe and respectful maternity care. And I would say we've got some of the experts here in the room on that the World Health Organization in 2021 said we're going to devote World Patient Day to safe and respectful maternity care. As part of that, FIGO described an ethical framework for respectful maternity care. We created a childbirth Bill of Rights that outlined what are the elements. We took, especially FIGO, working in collaboration with the Royal College and ACOG, came up with an incredible document on what we should look at as a childbirth Bill of Rights. But when I say some of the most important expertise is right here in California, nothing beats the California Maternal Quality Care Collaborative. It has been in place. I was at the first meeting back in, I think, try to remember 2006, when Elliot Main suggested we do something like this. Nobody in the world has done what CMQCC has done so well. If you look at where we were with maternal morbidity and mortality back in the 2000s, we can see the trajectory has continued to go up for increasing maternal mortality ratio in the United States. And in California, we've continued to drive it down because of a systematic approach to health and well-being of women in labor. They've got incredible toolkits that you can use. And we've got a Surgeon General who's an OBGYN, and Dr. Diana Ramos has advocated for, as we were starting all of the work on CMQCC, advocated for interconception care, for preconception care. And, you know, you could talk about it as a shotgun approach because we did so many things simultaneously, but those simultaneous things have really improved California's health outcomes. And now it's led to the United States having an alliance for innovation in maternal health. And with it, they've adopted bundles of care, a resource library, and resource kits so that every state in the United States can learn and achieve the same great things. So this is incredible. We need to amplify the message. It's been very powerful. So amplifying that message is critical. I would say in that initial sphere that I showed you, we own the environment. We are the experts when it comes to the environment, and we have to embrace that knowledge because nobody else is speaking up on women's health and pregnancy outcomes like OBGYNs can when it comes to environmental exposures. And you might say, why does it matter? But I would say, why have diseases increased so much over the last 40 years? If we look at environment and disease, genes haven't changed in a short time period. But we do know our environmental exposures have. There are epidemics of diabetes, ADHD, asthma, obesity. There are environmental, dietary, behavioral changes, all within a context of a genetic milieu. We will never understand etiology of diseases unless we put in a factor of the environment and help explain some of the disorders that are taking place. And I'm going to show a series of graphs that I've got from Dr. Linda Birnbaum, who was the head of NIEHS for many years. If we look at childhood autism prevalence in the United States, it's continued to increase exponentially for many years. Percentage of children with ADHD has increased. And particularly if we look at testicular cancer, breast cancer, hypospadias as a reflection of disorders of the genital tract, and decreasing sperm counts, diabetes and asthma, all of them have changed over a very short time period. Again, if I say more than what we would expect from genetics alone. And if we look at IQ, I thought this one was a very interesting look. The figures talking about total number of IQ points lost. And if we look at this, if you look at just the combination of IQ effect of methylmercury, organophosphate, pesticides, and lead, there's more IQ lost from those factors than many of the other things. We can look at some of the medical conditions, congenital heart disease, preterm birth, diabetes, all of those, more from what we know are some very important environmental factors. And I think if we look at ourselves, we know that we've forgotten history. We know about thalidomide. Thalidomide was an in-your-face disorder, but it led to huge changes. But we kind of forget about that. Methylmercury in Japan in the 1950s and 60s. We know it was there, but we kind of forget about that. Diethylstilbestrol should be in everybody's back pocket for knowing disorders, but we kind of forget about that. Lead today. Lead we've known for how many years, and still today we see problems with lead and the endocrine disruptors of the 21st century. So that whole host, we are the world's experts on environment, but somehow OBGYNs don't understand why we need to grasp it and why we need to have it be part of our practice or an important element of our practice. So what I'd like to do here is one of the things that we often hear, and I'll get into this a little bit later, is that there's not enough research around this area. And to me, the most powerful publication is the NIEHS EPA Children's Environmental Health and Disease Prevention Research Center Impact Report. It's a mouthful. Just Google NIEHS EPA and you can get this. This volume of information takes the science. So when somebody says there's not enough science about this, there's not enough science about that, it's in here. And we can use this as our most important resource. If you look at one of the infographics from it, the number of children diagnosed with leukemia has increased by 35% in just 40 years. 35%. Again, more than we can call just genetics alone. 8.4% of the children in the population have asthma, and we've seen this incredible increase in autism. 1 in 42 boys with autism. So children in the United States are very high risk for chronic health diseases with a strong environmental component there. So I took this right out of the NIEHS book, and it's leveraging the expertise of researchers across the country. If you look at when this first started, 1990s, continuing until now, $301 million in grants, 46 different grants. And I'm trying to remember how many research centers, I think 28 research centers across the United States, the powerhouses of the world, if you ask me. And if you look right up there, I see UC San Francisco as one of the most important powerhouses, with UC Berkeley right across the bridge, UC Davis up north, UC University of Southern California, and all across the United States. The research taking place here is incredible. And although this might be a little bit overkill, I thought the most important thing was just to take one statement after the other from this and show it to you. If we look at consistent associations between childhood organophosphate pesticide exposure and asthma symptoms and reduced lung function in children. Publications from this. PAH impaired T cell function. So we're seeing T cell behavior function is associated with asthma morbidity and decreased lung function. Maternal exposure to phthalates during pregnancy is associated with decreases in fetal growth. Prenatal exposure to organophosphate pesticides associated with preterm birth and shortened gestation. PBDEs, flame retardants. Some of the most important work on flame retardants for the state of California came out of UC San Francisco with Dr. Woodruff, associated with decreased birth weight. Latino fathers exposed to known or possible carcinogens like pesticides, polycyclic aromatic hydrocarbons, PAHs, it's easier to say, are more likely to have children with leukemia. So we're seeing those correlations. Leukemia is associated with tobacco smoke, pesticides, paint organic solvents, PCBs, polybrominated diphenyl ethers, the PBDEs, and PAHs. There's disturbance in the immune system, can play a role in neurodevelopmental disorders. And we see maternal immune dysfunction can result in autism, spectrum disorders, and metabolic conditions. Exposure to chemicals, mercury, lead, arsenic, and pesticides have an impact on brain development, cognitive delay, IQ changes, rates of anxiety, depression, behavior, learning disorders, ADHD, shortened attention spans. Phthalates are associated with developmental delays, and ASD rates can be doubled for any woman who lives close to a freeway during pregnancy. Endocrine disrupting chemicals are associated with childhood obesity, type 2 diabetes, and children prenatally exposed to phthalates begin puberty either earlier or later, depending on the sex. We've seen dietary exposure to arsenic, again, one of those heavy metals that we're concerned with. Impacts the fetal immune system, respiratory infection and wheezing. The BPAs and PBDs and phthalates are linked to neurobehavioral problems, obesity, reproductive effects. Prenatal exposure to phthalates impacts pregnant women and birth outcomes. Exposure to phthalates and BPAs associated with disrupted placental development. And we see exposure to phthalates associated with preeclampsia, intrauterine growth restriction, and pregnancy outcomes. I mean, this is a mouthful, but these are the research studies that have taken place for over a 30-year time period. Some of the top science programs in the entire United States saying, we can't put our heads in the sand any longer and say that there's not an association between environment and pregnancy outcomes. We can. So we need to be very forward about that and quit trying to backtrack and say, well, there's not enough research. There's plenty of research. We need to advocate on behalf of women and children. There was a recent study that came out of Germany, looked at neurotoxic mixtures of chemicals extracted from the blood of pregnant women. And in this one, they looked at over 600 women in Germany, detected chemicals that showed impacts on neurite development, and then said, we're seeing an additive effect. We've got several different toxic chemicals and it's additive. So you're not exposed to just one, but several, we can see an effect. But what I enjoyed about their commentary was that human biomonitoring provides a new approach to include mixture effects in epidemiologic studies. So actually knowing a bioburden helps us be able to counsel patients and helps us understand some of the research better. We've got 20 years of microplastic pollution, and what have we learned? 20 years ago, we weren't thinking about the plastic water bottles and all the plastic that we're consuming. And now we know that microplastics latch onto the outer membranes of red blood cells. They're found in the feces of bottle-fed babies 10 times higher than what we see in adults. And the feces of people with IBD, irritable bowel, have 1.5 times more microplastic particles per gram than those with healthy subjects. So we're seeing potential health effects from plastics. And the conclusion from one of the first people doing plastic research said, 20 years of research, there's clear evidence of harmful effects of microplastic pollution on a global scale. And I know UC San Francisco has brought this out and looked at some of the chemical effects and the synergistic effect of plastics and climate change. And out of University of New Mexico, microplastics are in every human placenta. Now, some people will use that and say, well, then it can't matter. If we see it every place, then it really doesn't matter. There's a way of trying to minimize some of the effects. If it's in everything, then we don't need to say that it makes a difference. Yet when we look at all those disease processes that have increased over a 40-year time period, that's the backdrop of the disease. And again, chemicals in the international environment, 70 to 100,000 chemicals in global production. Low-income countries now lead the world in high volume production. So how do we discuss the science? I'm talking to the experts here. How do we talk with our patients and how do we share all the scientific information? Well, for me, I came down to some aha moments, and I've got 3 of them, and I realized I should have a 4th because my first aha moment was back in probably 2006 when we held the second International Preconception Care Conference in Oakland. And Dr. Hania Trosh at the CDC said, you need to call UC San Francisco. I know there's somebody doing environmental work over there. I really don't know what they're doing, but call UC San Francisco and have them be part of this. The AHA was Dr. Woodruff and Dr. Jadis coming and presenting to that conference because nobody was talking. We'd written an entire summary on preconception health, and there was nothing about environment in that summary. The first AHA moment for me, so now really the second one, I look back on that, was policymakers. We got a phone call. ACOG California is very powerful, does a lot of work. We got a phone call from the state legislature saying, what is ACOG's policy about lead and lipstick? We said, oh, shoot. Okay, lead's bad. We knew that much. We said, but lipstick's good, so it can't be bad. It must be okay. And we realized at that point, it was probably 2008 or thereabouts, we had no advice to give anybody. We just assumed everything was fine because we all used it. So it must be fine. We had never looked at it critically. So we went to Dr. Hal Lawrence, who was the CEO for ACOG, and said, could we write an opinion about environment at that point? So that was 2009, I think, was our first meeting here in San Francisco to talk about doing something like this. The second aha moment came with UC San Francisco saying, we've got to start navigating the science. And what you all pointed out is our brains are in one area, the pharmaceutical world. All of us, we're physicians, so we live in the pharmaceutical world. The pharmaceutical world says we aren't going to expose any human to anything that's a problem. We have to do all this research before we expose people to it. That's our pharmaceutical world. So my aha moment was when Dr. Woodruff said, that's not the way it is with the manufacturing world. You don't take a chemical out of production until you've proven that it causes harm. Well, what kind of standard is that and how hard is that to do? It's very, very hard. It takes many years and many dedicated scientists. And my third aha moment is prenatal vitamins are contaminated with toxic chemicals. Heavy metal contamination of prenatal vitamin. This study was published in 2018, and I'll get into it in more detail later. But Dr. Nate DiNicola has done a lot of work chairing the committee on FIGO's committee on climate change and toxic environmental exposures, saying, wait a minute, every time we do a test on prenatal vitamins, they have toxic chemicals in them: lead, mercury, arsenic, cadmium, pesticides, you name it. So the third aha moment was, we've got to worry about our prenatal vitamins because we're using them every day. So when it comes to policy reform, we've changed our pharmaceutical world so that it's not a no risk world, but it's lower risk. So why have we not been able to hold the manufacturing industry to the same kind of standards? The burden of proof falls on you and me and not on industry. That's not the way it should be. The same is true of the supplement industry. And I'll go into that in more detail. The supplement industry is like the wild, wild west out there because there are really no regulations. Patients just assume everything's fine and safe. We do have examples. We can look at what is called the wingspread statement from 1998, when a group of biologists and physicians got together and said, when an activity raises threats of harm to human health or the environment, the precautionary measures should be taken, even if some cause and effect relationships are not fully established scientifically. That should be our guidance, that we work at the level of protection first. Now, the United States hasn't taken that to heart, but the European Union has. And the European Union has built that into their basic law, saying where there are threats of serious or irreversible damage, lack of full scientific certainty shall not be used as a reason for postponing cost-effective measures to prevent environmental degradation. And the EU uses this as a foundation for much of what they do. In 2013, the committee opinion that I was talking about came to fruition. I like to show 2013. Oh, sorry. Oh, no, it doesn't give credit. I thought it had everybody's names on it, but it doesn't. I apologize. But I will say it's UC San Francisco should get credit for the work that went into this, because it's an incredible document that looked at exposure to toxic environmental agents across a woman's lifespan. So it's not just reproductive health and pregnancy outcomes. In 2015, Dr. Linda Giudice took this a step further and said, let's take it global. So in 2015, we introduced this topic to FIGO and wrote a global opinion. And the important part of writing these opinions is then researchers who really don't know OBGYN can say, look, at the most important organizations in the world are saying we need to have this guidance. So Dr. Giudice led an entire team, Patrice Sutton and Tracy Woodruff here, to provide global guidance. It's the first global opinion about women's reproductive health and exposure to environmental toxics. And Dr. DiNicola is updating the opinion this year as at work at FIGO. The air we breathe, the water we consume, the food we eat, and the products we use. We've got the work from Dr. DiNicola, Dr. Zlotnick here on toxic environmental exposures in maternal, fetal, and reproductive health. And if we go to this reference, we can look at examples of the different types of chemicals. What are the adverse health outcomes that are outlined here? And what we can do, avoiding heating in plastic, minimizing plastic containers, washing hands, avoiding fragrance of feet. So the recommendations are pretty standard and things that we can do. I've added to this now with some of our research that I'll show at the end about just washing produce. By 2021, we took on climate change. And again, I'll show you, this was right before the Scottish meeting on climate accord. But again, it was Dr. Zlotnick and Dr. Giudice, Dr. Woodruff and Dr. DiNicola saying, let's look at this and look at OBGYNs as leaders. Because whenever it comes to a climate crisis or when it comes to any type of adverse outcome here around the world, when we see a crisis, whether it's hurricanes, whether we see it's storms, the last people invited into the discussions are OBGYNs. But we know that it's our population that's being affected. So if we look at environment and health, I'm going to talk a little bit about climate change, environmental toxicants, and what we can do. Air pollution. Again, I'll say Dr. DiNicola here, 33 million births in the United States analyzed, and they found an association between PM 2.5, so particulate matter, preterm birth in about 80% of studies, and low birth weight in about 86% of studies. Their conclusion was an exacerbation of air pollution and heat exposure related to climate change may be significantly associated with risk to pregnancy outcomes in the United States. And that research has gone on to be replicated in one study after the other. This is a summary on air pollution and racial disparities in pregnancy outcomes in the United States, a systematic review. Findings across all reviewed articles showed more adverse pregnancy outcomes related to exposure to air pollution among Blacks and Hispanics than among non-Hispanic whites. So we've got a justice and equity issue, the same as we do when we talk about environmental toxicants. Let's look at heat. Heat exposure, and we're talking about mammals. So we kind of always, for years have said, well, we're mammals, we thermoregulate. We don't really have to think about this. It's not an issue. But heat exposure in any trimester has been associated with adverse pregnancy outcomes, including preterm births, stillbirths, and low birth weight infants. I'm from the Sacramento area. We used to, years ago, 30 years ago, joke about the state fair in August. It was always in August, and the preterm labor. Did we ever think that it was a cause and effect? We just kind of thought, well, look at what we're seeing. And now years later, we're saying, guess what? There is a cause and effect. There's growing evidence that pregnant women are able to appropriately thermoregulate, but when exposed to extreme heat, there are a number of processes that can be taking effect that harm both the mother and the fetus. It may be placental blood flow, it may be dehydration and inflammatory responses, and they all can be triggers for preterm birth. So making sure that we provide some kind of safe environment against heat is critical around the globe. And then if we switch to environmental toxicants, the figure on the right just shows you the whole alphabet soup of different types of chemicals that impact both preconception, pregnancy, and long-term women's health outcomes. In terms of pesticides, I'll make it pretty straightforward. I said right at the beginning some of the examples, but proximity to agricultural activity makes a difference. And some of the best research has come out of Salinas and the Central Valley of California. The epidemiologic studies of low birth weight, fetal death, and childhood cancers are associated with proximity to agricultural activity. Higher prevalence of cryptorchidism and hypospadias are found in areas where there's extensive farming and pesticide use, and in the sons of women who are working as gardeners. There's a relationship between cryptorchidism and pesticide concentration in maternal breast milk. The impact of endocrine disruptor pesticides and fertility with ovulatory dysfunction and sperm function. And some of the best research on this has come out of Asia and Taiwan, and looking at the tea foundations or tea plantations. Project Tender is one of the most important groups. It's a group of scientists, health advocates, professionals who are interested in looking at neurodevelopmental risks. And they've looked at a number of toxic environmental chemicals. They took on organophosphate exposure and said, when we look at this, exposure during pregnancy is associated with developmental abnormalities, reduced motor function, decreased IQ, and studies show an association with ADHD and autism. Another group of chemicals, PFAS, the problems with PFAS. And Linda, I'm sure that this came out under your tenure as chair with the problem with PFAS, because this is a infographics produced by UC San Francisco, the Health Alliance of the European Union, and FIGO, summarizing what it does so that anybody can download this and use that in their practice. How does PFAS get into our bodies? What are the health problems and what we can do about it? Dr. Blair Wiley is going to be the president of the Maternal Fetal Medicine Society. And Dr. Wiley wrote this really impressive article on Beware of Forever Chemicals with guidance on what we need to do. How do we avoid PFAS? Where is it found? And what can we do? Nonstick cookware. I remember the first meeting here at UC San Francisco when they said, what was the hardest step that you did? I said it was getting rid of my nonstick cookware because I loved it. And I had to throw all of it out when I heard these studies. So we've got a number of different sources that get right to the heart of what we need to do to change some of our behaviors. And she summarized what are the systems affected, and endocrine system, altered thyroid function. When we see thyroid function altered, we know that we're going to be looking at potential impact on the fetus and neurodevelopment, immunologic, metabolic, reproductive, and developmental. They used simple steps to limit exposure to PFAS. Don't microwave popcorn bags. They're lined with PFAS. Cut back on takeout delivery, discard frayed carpeting and upholstery, use an alternative water source or filter. Filters are really important, and get rid of those nonstick Teflon pots and pans. Again, another study looking at maternal infant research on environmental chemicals said essentially the same things, that we've got to look at contribution, that PFAS is going to impact offspring health, decreased fetal weight, preterm birth, neurodevelopmental disorders, and there's transplacental lactational transfer of PFAS. So it's a bad actor. And your own Dr. Max Ong was quoted about where they're persistent and that they can remain in your body for several months to years. So FIGO in 2021 called for the removal of PFAS on a global scale. And we said we needed to act with precaution to reduce or eliminate exposure. And then finally, I said I'd get into prenatal vitamin contamination. Dr. Michael White, who's a pharmacist, said we've got the wild, wild west here, and described the Dietary Supplement Health and Education Act specifies that dietary supplements must be manufactured free of contamination, but it allows them to be sold in the United States without providing proof of quality by the FDA. So it's up to the FDA to prove that a product is unsafe to take it off the market. So that was that regulatory thing. He said it's the Wild West scenario where companies blatantly disregard consumer safety, honesty, and integrity. The article that I mentioned earlier, Dr. Schwalfenberg from Canada looked at 26 prenatal vitamins. All of them were contaminated. All samples contained lead, aluminum, nickel, titanium, and thallium, and arsenic above acceptable levels in some. We've got an article from Gastroenterology said herbal and dietary supplements are unregulated hepatotoxicity. Another study on multivitamins and minerals said the same thing. We've got 32 non-prescription, 15 prescription products. Arsenic, lead, and cadmium were above USP purity levels, and USP purity levels are not zero. They're still higher than what you would want. And heavy metals and phthalate contamination are found in prenatal vitamins and folic acid. So pretty much every study that's done says they're contaminated. The US Government Accounting Office heard all of that and said, well, we'll do our own study and really show whether we have to worry. Their statement came out in 2023 and said that the FDA regulates over-the-counter and prescription prenatal supplements. Neither type is required to be evaluated for effectiveness or safety pre-market. So we don't need anything to say that they've been evaluated. The limited reach, their conclusion, the limited reach of FDA's oversight, including prenatal supplements, could lead to unfavorable health outcomes for vulnerable populations. The FDA does not have a systematic mechanism to identify when dietary supplements that do not contain new dietary ingredients enter the market. So it's a wild, wild west. And these are just some of the fast facts description of what they said. They did their own study, 12 prenatal supplements, and they found trace amounts of lead or cadmium in half of what they tested. FIGO came out with a statement under Dr. Nate DiNicola in October 2023 and said toxic chemicals and contaminants determination that we took a group of global experts and said, what really should we make sure we don't come encounter with? And came up with a list of what those were. We said we've got potentially toxic environmental chemicals, we've got heavy metals, and we've got microbials that should not be in anything that a pregnant woman uses. And in FIGO's recommendation, we said patients should only consume, clinicians should only prescribe vitamins and supplements that have been independently assessed to make certain they do not contain contaminants. Manufacturers should be held to a standard of production that assures safety and minimize contamination. And we should work to certify all prenatal vitamins meet the standard of care. We've got Dr. Judice saying the magnitude of chemical exposures and their effect on parental, fetal, and postnatal health makes it imperative that clinicians assess an individual's and a couple's risk of exposure to environmental hazards as a routine part of fertility. So can we improve our guidance? Well, is it possible to measure toxicants in urine and blood and guide patients about exposure? Yes, it is. We've got different, you can buy PFAS kits over the counter on Amazon. I went and looked. Is it possible to measure toxicants in consumer products to determine which ones can cause harm? Yes. Agilent technology and their mass spectrometries have revolutionized what we're able to do and what we're able to identify. And we've got a committee like Climate Change and Toxic Environmental Exposures that say we need to translate the research, we need to advocate for change, and we need to educate everybody about the risks that we're seeing. So what are some of the solutions? Well, we've got biomarkers for clinical care. We're pretty comfortable with that. Dr. Perlis looked at translating biomarkers into clinical practice. He said these are measurable characteristics of an individual. It can be a chemical in their body, it can be some reflection of a disease process, but they're measurable, and you can use that to guide your advice for any given person. Why not with bioburden and exposure to chemical contaminants? The quandary is a change in a biomarker enough to say we're going to have an outcome change? How large change is necessary? Have we adequately assessed the risk? Are we improving our risk assessment with the use of a biomarker? Will it change patient management? And will test results change patients' behavior? If they know what their level is, do they change their behavior? Does a test change a patient's adherence? Is there a cost-effective analysis? And then he gave some examples. We've got sepsis protocols now with lactic acid that have drastically changed our ER view of things. We've got neurodegenerative diseases, and just yesterday, an article came out with the tightest Alzheimer's biomarker yet seen. Not yet on the market, but it was very impressive. We've got Crohn's disease, looking at how to respond to Crohn's disease management based on biomarkers. So can we measure toxicants? We can. This study out of Australia said we need to change our practice, and he said we're unveiling the elephant in the room. We've got a growing body of evidence, what I've said already today, of chemicals in the air, water, soil, food, building materials, household products that all can be affecting our health. And consumers are interested in science. We've got 40,000 smartphone health applications. 60% of mobile phone users have downloaded a health app. And then we've got advances in chip technology where you can hold your finger and get information from your cell phone. And then we've seen genomic testing, although we've seen genomic testing take a dive with what's happening here with 23andMe, but genomic profiling for as little as $99 with the database. Their point is that there's widespread adoption of information technology applications requires behavioral adaptations as much by clinicians as by patients. Clinicians need to be receptive to the shift in their patient awareness and direct them in a healthy fashion. We have that unique role where we can identify the regulatory environment, we can identify the chemical exposures, and look at what a patient's risks are. So what are some of the challenges with using bioburden or any markers? What's the environmental chemical assessment? And we've overlooked it so far in our practices. It gets into very complex science. We've got inadequate chemical regulations. We've got inadequate training in environmental medicine. We've got lack of information on environmental chemicals in the medical journals. You know, when we talk with OBGYNs about why we don't even know all of the publications in NIEHS and the EPA, it's not in the Green Journal. There are certain articles in the Green Journal. There are certain articles in IJGO or the British Medical Journal, but mostly they're in ASRM stands out for probably having the most articles on endocrine disruptors than any other publication. But it's not in what we're normally looking at. It certainly isn't on our boards. Limitation of current biomarkers and laboratory tests. We've got time constraints, funding constraints, and political constraints all working. But if you talk with some of the individuals who are looking at health risk assessments and epidemiologic studies, they've said due to the historically high costs of gathering information, it's very difficult to do epidemiologic studies, and they've generally relied on zip codes or modeling rather than on personal measurements. It's easier to say somebody's in this zip code and kind of infer what their chemical exposure is than going out and doing an easy blood test and seeing what somebody's bioburden actually is. But they pointed out at the same time, when you actually have measurements of chemicals, when they can be obtained, you've got much stronger models than when you're using a zip code. So biomonitoring is an important direct method of monitoring exposure and measuring doses. And I would say, to me, the most important step is empowering women. When you give women knowledge, they can act upon that knowledge. And if it's not about empowerment, we failed women. I think one of the most important examples that's come out of this is Dr. Jose Cordero and the work he's done in Puerto Rico. And in Puerto Rico, they looked at women exposed to phthalates and had them in 4 different quartiles. The top quartile was the one high phthalates. And we saw that phthalates are associated with preterm birth, low birth weight, shortened gestation. Those are the highest risk group. When they went to a pretty extensive means of showing women what their bioburden level was, what their phthalate measurement was, and giving them advice on how to reduce phthalates, they were able to take women from the 4th quartile down to the 1st quartile and change outcomes. So women can use that information and respond to them. So empowerment respects and supports women's autonomy and allows them to manage their pregnancy, transforms fear and uncertainty. And I know when we first came out with the first opinion from ACOG and ASRM on chemicals, Linda and I talked a lot and said, we've got to take this balance between being aware and being alarmed, because women already worry about their pregnancy. So if you put them in this field of guilt, we will have failed. But if you get it so that they feel that they can react with power, we haven't failed, we've actually empowered them. So again, they had participants of the metals exposure study in homes use the information that they received, and they changed their family's household behaviors and initiated specific interventions. And in that, they found changes. So why is guidance needed? You always like to throw your grandchild. This is my grandbaby, so yeah, like to throw kids in there. So we have to be able to amplify the messages, as I said, with WPSI and AIM and CMQCC. We know what we need to do. We just have to amplify that message. But we also need to train individuals like yourself. So I know all of us have said, if you want a PowerPoint presentation, we're happy to send it to you. You can take this PowerPoint presentation, download it, use it, and just promise me you'll give the same talk or change it and give more talks to other people, because we've got to be able to train more people in awareness. And we all have a host of different types of talks that we could share with all of you. But training others is the most important step. We also need to know what the research tells us. What is it about bioburden? Are there biobanks that are giving us information? Where do we have electronic research data? And we should be requiring a certification of vitamins and products. You're doing the research, so what would you tell your patients? Tomorrow, for you who are going to Lobby Day at the state capitol, what do you tell the representatives there about women's health and the risks that they have in the environment? They're going to ask you about preterm birth. Can you see that you could make a change? And measure a bioburden. What is the level of toxicant in an individual? And then give them some counseling, just like we do. Can we do it without that? We sure can. But somehow, sometimes knowing a measurement like your cholesterol level gets you to nudge a little bit more, so we can give the same type of advice. So what can you do? Well, recommend healthy choices. And no need to be the expert on exposures. Eat healthy. It's your diet and your exercise that making sure we've got a very healthy diet. You can measure body burden and then see if somebody will change their behavior and remeasure. You can now establish a T2 committee, Climate Change and Toxic Environmental Exposures Committee, in your society, in your hospital. Give this lecture to your hospital, your colleagues, any place. Advocate for safe chemicals and a European Union standard, more than what we've got with our what's happening with the EPA. Reduce your carbon footprint. Reduce plastics. Know your exposures. Don't heat in plastics. Look for a P2I seal of approval coming soon, so we can look for it on vitamins or on products. Something as simple as it's not necessarily easy to eat organic, but we've all realized that 2 great studies looking at washing produce. If you take 2 teaspoons of baking soda in a quart of water, wash for 30 seconds, that cleans your produce. So even if you're not able to eat organic, you can at least rinse better than we've done in the past. Get certified and teach others. And then use some of our really important resources. Safety Nest was created by Alexandra Dressler, who I think lives over in Oakland. And I know she's consulted with Dr. Woodruff and me. She uses only ACOG guidance for her recommendations. The Nest is the home. So you can tell a patient to download Safety Nest and go through the home and see every change that you would need to make in your home to make it safer. This one I love, Clearia app. This individual contacted Dr. Judice and said, well, how do I get this out to people? And this is an app developer who was so frustrated with not being able to read labels that you can now take his app. I tried it at Target and just hold up, like a shampoo or air conditioner, and it'll show you all the different chemicals on it and tell you, is it banned? It's a toxic. What do you have to worry about? So the app is easy to download, and I think is worth telling every patient to have that. And then you've got EWG, gives advice on water filters, on air filters, and on chemicals. So if ever you wonder about a chemical that you're using or you've been exposed to, you can go to EWG and put it into their search engine and just ask about it. It was Ban Ki-moon, the 8th Secretary General of the United Nations, who said in 2011, saving our planet, lifting people out of poverty, advancing economic growth, these are one and the same fight. We must connect the dots between climate change, water scarcity, energy shortages, global health, food security, and women's empowerment. Solutions to one problem must be solutions for them all. And that leads us back to where we started. We can amplify the message about well women healthcare. We can amplify the message about safe and respectful maternity care. And then you and I own the message on the environment. And it's up to us to get that word out there and work for every woman, every time, everywhere. Thank you. Questions? I'm speaking to the world's expert here, so. Can you change your practices a little bit? I think it was Tracy pointed out, we don't have to be experts on environmental health. There are just a couple chemicals or a couple ways to look for some of the chemicals, and we can give guidance that way. And it's easy just to give people an app or say, go look it up in EWG. EWG is probably what I've used more than anything else to just figure out what chemicals I need to be avoiding. Yeah, Linda. So I'm going to put in a plug because we've been working on this, and this is not ready for prime time because we put it together and we are finalizing it right now. This was like the first draft, but it's called Preconception to Infancy. And in it, we've broken down to each of the chemicals and say what the sources are, what the research is, usually using the 28 research centers there, and recommendations of what can be done. And with every single chemical or every single exposure, we give examples of what we can do to mitigate the effect, how we can reduce organophosphates, how we can reduce phthalates, what it's going to take from individual behaviors. Bioburden gets a little bit more complicated. We've actually been working with a lab. I started working with them back, I think, in 2014 or 2015. And I remember sitting them down. My daughter wasn't quite pregnant at the time. And I said, if you could get a test down to less than $100, I could see her ordering something like this and just getting an idea what the bioburden is. And they've now got it down to about 100, not the PFAS test. I pulled that off of Amazon just to show that they're already out there. But they can do they're working at getting a complete bioburden for patients. And then Nate's working on AI to be able to give advice on, if you've got this level, what would you do? So that's a work in progress right now for us. I would love to be able to say for $100, $120, you're going to be able to do a test on phthalates, PFAS, organophosphates, and 15 heavy metals. The FIGO is actually the whole FIGO list. There's 120 chemicals, the PFAS, phthalates, PBDEs, and 15, 20 heavy metals. I always say 15. It's 24 heavy metals, 120 chemicals, and then this other group of the CMR. And the one lab has already been able to do all of that, and I think other labs will follow. Yeah. It is right now. Oh my gosh, you're my audience plant. It is right now. Kirkman, not Kirkland, Kirkman Vitamin. So I have nothing to do with Kirkman. I don't own anything. Well, they're not public yet, but they meet the seal of approval. They tested and they've got no chemicals. They have no contaminants in it. And the interesting thing is when you get investigated by the GAO, I'm sorry, I was supposed to ask the questions. Sorry for the people in the audience. Do we have how long will it take for the certification to happen? It's happened already. Kirkman Vitamins from Washington has met the seal of approval. They've tested and have none of those contaminants. What we found with the GAO when they started looking at baby food is that most of the baby food producers said, oh, this standard can't be met. It's too high. We've got arsenic in our food. We've got all these and we can't do it. So Gerber and all of those were there saying we can't meet it. And then Serenity Kids came along and the guy owning Serenity Kids said, well, you can, you just have to work a little bit harder. And his products were all clean. So that was kind of the way we looked at this. Well, if you can do that for baby foods, why can't we do it for prenatal vitamins? So Kirkman has already done that. We think the more we get word out there that we've got this standard and certification and that OBGYNs become aware that vitamins are contaminated, that it will make a difference. So I saw here. Yeah. Great question. So this has to do with two things. Number one, lobby day tomorrow is taking place and the state passed a law 2 years ago about baby foods and testing for 4 heavy metals. Only 4, not the 24 we recommend. So it's a very weak bill, but it at least passed. So I contacted ACOG last fall and said, hey, could we do the same thing on vitamins? And I got the phone call Saturday saying, we did, and can you come tomorrow? So it's a first step, which is really, really important. Your question is very good, though. How do we get our Medicaid? 50% of the deliveries in California are Medi-Cal. So how do we get that? Well, we need to lobby Medi-Cal. We can talk with Dr. Diana Ramos, who is an OBGYN and understands environmental issues. So we're going to definitely talk with Dr. Ramos and the Medi-Cal area and just see what can we do. And we can't go and test. We can't knowingly go and test all these vitamins. We can have somebody do it, but if you notice every one of the publications, they hide the labels. I think it's as much a liability issue as anything else. There's Lead Safe Mama. She tests everything and then publishes it because she doesn't worry about the liability. So we can't do it. We just know that everything that's tested is pretty much contaminated. If the state requested, we could ask a lab to do that for us and then say, look at the state, you're giving this to all of your underserved patients. Can we bring a change? But we can't do it without their permission. But that's an excellent point and one where we want to bring that up to the state Medi-Cal office. I thought there was another question in the back. No. Oh, that was yours. Okay. Yeah. 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 And I think that's really an important point because no folic acid when you're telling somebody to take this vitamin. I mean, that's a serious ramification and one that's why I still say it's one of my aha moments. I had no idea the prenatal vitamins that I've prescribed for 30 years might not have even had folic acid in them. So it's a serious thing that we all recommend and we can make a difference. So we'll see. Thank you, everybody. And I'm serious, if you want the lecture, Patrick has it, he can give you a copy of it. You just have to promise, you can take my name off, put your name up, but you have to promise to give the lecture, okay?